As the Veterans Affairs scandal unfolds, many are wondering if we should just give our vets healthcare vouchers and let them choose where they get treatment. Former Navy SEAL and lone survivor author Marcus Luttrell told us that would be a viable solution in his estimation.
If you have a combat veteran really that was in there and they got messed up and needs the care that he needs, you just hand him one of those cards. It walks in and then he gets it. No questions asked.
Free him up. Avik Roy is a senior fellow at the Manhattan Institute. He's also pro-voucher for vets and believes privatizing healthcare would be better for the vets, and he joins us live this morning. Good morning to you. All right, how would it work?
Well, basically what you do is you take the same pot of money that we now spend on veterans' health care, and you give that to the veterans in the form of a premium support payment or a subsidy or a voucher, whatever term you want to use, so that they can buy private insurance.
Okay, if they were able to do that, what would happen to the VA hospitals?
Well, the VA hospitals could be opened up to compete with every other hospital in America. So right now, one of the biggest problems in America is that these hospital systems have become monopolies in certain parts of the country. They charge whatever they want to charge. They don't have to compete with other hospitals, and so the price of healthcare goes up. If you let the VA hospital system and those hospitals compete, then they can compete for those patients. They can compete for private patients. They compete for veterans, and prices will go down.
I have heard, Avik, some people suggest, you know, the VA is antiquated. It doesn't work these days. Just let everybody go to find their own doctor. But you're suggesting, instead of doing that, go ahead and continue the VA system as it is, but give vets the option of either going to your own doctor, here's your special hospital card where you get the great treatment, or go to the VA.
Right, and let civilians go to the VA hospitals if they want. That will force the VA hospitals to get better because they'll have to compete with the other hospitals that are out there.
You know, it's interesting. Mitt Romney suggested this during the campaign, and he got all beat up over it.
You know, I mean, maybe at that time the appetite for change wasn't there, but hopefully with this tragedy that we're having now, the scandal we're having now, maybe it'll be a catalyst for people to see that this system is broken. People who've been involved in the system can tell you there are a lot of problems in the VA system.
You just called it a scandal. I call it a scandal. The President of the United States yesterday was out there, despite all of the reports that had already come out that said for years they've been using these gaming strategies. I don't think he seriously considers it a scandal at this point. He's waiting for another report from the Inspector General, who already said nobody died because of these stupid schedules.
Well, there's a reason for that. So the VA system is completely run by the government. So there are a lot of intellectuals on the left who say, this is how you show that socialized medicine works. And so if the president goes out and says, no, the VA is messed up, the VA is broken, he's admitting that government-run, government-controlled, government-operated healthcare doesn't work, and he doesn't want to do that.
And if this is how they operate the VA system, just imagine how they'll operate Obamacare 10 years from now.
That's a lot of the concern, yeah.
All right. Avik Roy, thank you very much.
Nice to be with you.
It's a good idea. Let's hope somebody's watching and they at least consider it.
Absolutely.
All right. Thank you, sir.